High blood pressure, also known as hypertension, is often dangerous because the person rarely shows any perceptible symptoms. Millions of people in the world live with high blood pressure and don't even know it. The danger of untreated hypertension is that it increases the risk of serious problems like heart attack and stroke. We will give some tips on how to treat high blood pressure naturally, some things you can change in your life to reduce the risk or even control blood pressure. How to treat high blood pressure. Reduce salt consumption. One of the main ways to reduce or control blood pressure is by decreasing salt, sodium, consumption. This is because salt raises blood pressure. The recommendation is to eat only 5 g of salt per day, about 1 teaspoon. To reduce salt, it is recommended to eat fruits, vegetables, milk and yogurt, whole grains, lean meats like fish and chicken, and legumes. Try to eat 5 servings of fruits and vegetables per day. Avoid ultra-processed foods that are full of sodium. Increase fiber consumption. Lose weight if necessary. When we are overweight, we force our heart to work harder to get blood to the body. This can cause an increase in blood pressure. Losing at least 5% of your current weight will already show a considerable improvement in health as a whole. Get physical exercise. Getting just 2.5 hours of physical exercise per week lowers blood pressure. This is less than 30 minutes of exercise per day. Furthermore, exercise will help with weight loss if necessary. Cut out alcoholic beverages or try to reduce daily consumption of alcohol can increase blood pressure over time, even if the person is in good shape. Moderate consumption is recommended, which is 1 drink for women, a 350 milliliters can of beer for example, and 2 for men per day. To give you an idea, some drinks can increase blood pressure by 1 millimeter of mercury for every 10 g of alcohol consumed. For example, 1 drink contains 14 g of alcohol. In addition, alcohol has many calories that contribute to weight gain. Reduce the amount of coffee. Yes, unfortunately, coffee is harmful to those with high blood pressure. It is recommended not to drink more than 4 cups of coffee per day. Some studies have shown that caffeine can raise blood pressure even more if the blood pressure is already high. Coffee also includes mate tea and other beverages that contain caffeine. Stop smoking. Cigarettes are one of the main causes of stroke in the world precisely because they increase blood pressure. Smoking causes arteries to narrow. If a person is a smoker and already has high blood pressure, the arteries will narrow much faster, absurdly increasing the risk of heart and lung disease. Try to sleep well. Sleep is extremely important for good health. Try to sleep at least 6 hours per night. Long-term sleep deprivation is associated with increased blood pressure and an increased risk of hypertension. These are the main tips on how to treat high blood pressure naturally by changing some habits in your life. Medications for hypertension. If blood pressure does not return to normal or stabilize after following health recommendations, it may be necessary to use specific medications for hypertension. The types used are diuretics, furosemide, indapamide, etc., vasodilators, hydralazine and others, angiotensin-converting enzyme ACE, inhibitors, captopril and others, calcium channel blockers, nifedipine and others, beta blockers, propranolol and others. But talk to your doctor to find out the best treatment for your case. Do not start taking blood pressure medication on your own as it is very dangerous. Blood pressure values. Blood pressure is measured in millimeters mm or centimeters cm of mercury, Hg. In medicine, hypertension is usually considered when the pressure is 14/9 or higher. These are the values and what each one represents. High blood pressure, 140/90 mmHg or higher. Ideal blood pressure, between 90/60 millimeter of mercury and 120/80 mmHg. Low blood pressure, 90/60 millimeter of mercury or lower. Therefore, if the pressure is between 12/8 and 14/9, it may indicate a risk of developing high blood pressure if the person does not take the recommended precautions to reduce or stabilize the pressure.